morning or afternoon, early afternoon, everybody. I think it was really remarkable that they've organized today's presentation with the youngest speaker and the oldest speaker back to back. I don't know whether there's a message there or not, but I'm really grateful to do this talk. I really accepted the invitation because I think the message that I'm going to talk to you about today is a message that we have to consider for our country and for the world, and that is to address the issue of poverty and the impact on the health and well-being of our children. And so what I want to talk with you about today is give you a little bit of an introduction to the issue that it exists right now, and then talk to you about why poverty is an issue, and really emphasize a concept to keep in mind, that I believe that your zip code is more important than your genetic code when it comes to your health. And I think there's another way to look at how we're delivering health. The Affordable Care Act is wonderful, and it's going to address a lot of needs, but it's really not going to address the fact that in the United States right now, there are millions of children who live in poverty. The classification for poverty here is a family that has $23,000 and has 4 people in the family, $23,000 to live. Could you imagine what your life would be like if that was your total income for a year? And that's actually on the high level of that scale. Right now, 22 million children die every year of poverty throughout the world. You don't even hear about this in the newspaper. You don't recognize this as an issue. Now, I'm fortunate enough to have worked at Children's Hospital in Oakland, which you heard in the presenter. And I wanted you to see this picture of these children because it's a gorgeous picture reflecting the health and well-being of children who were born and lived here 60 years ago. Because you can see these little bottles up on the shelf. Those are not the bottles you see in our hospital right now. But it really reflects the same diversity and the same issues that we face on a daily basis at our hospital. And I think they're beautiful kids, and Oakland is probably one of the most diverse cities in the United States, and we're proud of that. And our hospital is proud of, we serve every child regardless of their ability to pay. So 75% of the 250,000 outpatient visits we see in children are children covered by Medi-Cal. We are the county and we are the private hospital for the East Bay of this area, and we're proud to hold that banner. So what I want to talk to you today, hold on, I think I pushed the right button. It's not, is it, yeah, okay. 1/3 of the children, 1/3 of the population of the world are children, 1/3. And if we don't pay better attention to the health and well-being of our children, the cost of health care in the United States, which is currently astronomical, is going to get even worse. Even though there's access to care, the cost of care is out of control. And I personally believe, and my passion is the reason for that, is we are not paying attention to the root cause of illness in the majority of children. And that relates to social determinants and poverty. Poverty should be considered a disease, just like obesity is considered a disease. If we don't address the difference between the large economic gap between the wealthiest in our society and the poorest in our society, and do something to elevate the economics of people that live in poverty or low income, we are not going to change the health of our community. And the health of our children is the health of our future. So I went to medical school when the definition of healthcare, and many of you might consider this the appropriate definition, is what kind of medicines are you given and how is your medical illness treated? What drugs are created? I'm a hematologist, oncologist, as you heard in the presentation, and I've been amazed at the advances we've made in curing and treating a variety of diseases. But the diseases we see at the hospital represent 6% of all the children. 94% of the illnesses that we see are not complex, but they're the illnesses that cost us, the families, and society an enormous burden. Many people in this room might feel that life choices determine what your health is. Well, life choices are great to make if you have the dollars in your bank account and in your home to be able to make them. If you're poor or you're worried about any food on the table or can you pay your rent, you're not able to make the same kind of life choices. The other is in our DNA. So I love DNA research. I love the Human Genome Project. I think we've done a great deal. But as I said earlier today, I firmly believe that your zip code, rather than your genetic code, is going to be a major determinant of your health. And there are a lot of people in this room that feel, well, you're born that way and this is the way you're going to be, regardless of this issue of poverty. That's wrong. And I want you to leave this audience, this presentation today, with the thought that if we don't do something about this, we are not going to change the health of our society. And you all have capabilities of changing that. And there are ways that I'm going to suggest at the end of this presentation that I hope you carry away with this presentation and you think about how you can get engaged in changing this. So, example. Health is really determined by economics and social conditions. And I will tell you later on in this presentation some stories from different families that illustrate that this is in fact the case. And I'm going to give you examples of where I can demonstrate clearly that these things have occurred. Social determinants have a great impact on health costs and health outcomes. Yet, as a medical student, or as a physician, or as a nurse, we are really never taught about the impact of social determinants. We're more focused on disease. When I went into medicine, it was preventing illness. Now that I'm a CEO of a hospital, if I don't have sick kids in the hospital, I don't have enough money to prevent illness. The system is upside down. The system should be prevention and not illness directed. And until we change that, we're really not going to have an impact on the health and wellness of our children. So where you live is of great value. It's the best health predictor. But if where you live lacks employment, which many of our people in the poorer group obviously lack employment, lacks quality food, and you're going to hear speakers talking about access to food here, lacks quality housing, lacks quality education, lacks quality child care. We're one of the few countries in the United States that doesn't offer child care to everybody. And about 10% of all the child care programs never are certified or inadequate and expose kids to environments that leave permanent effects on them whenever they grow up. This is wrong. It should not be. In a country that's so wealthy, where there's this enormous gap in wealth, we should not tolerate that. We can't afford to tolerate that if we want to have children that are healthy. A high incarceration rate. We provide medical services to the juvenile justice system in Alameda County. 99% of the kids there are of color. Most of them never saw a doctor. They never saw a dentist. Many of them have hearing defects, and many of them have visual defects. Put that all together in poverty, and you find yourself in jail, whether you ought to be in jail or not. That has to change if we want to change crime and violence in our society. And I think we have not done the job that we should, and I think some of the reasons we're having problems that I'm mentioning here are because we really haven't paid attention to what we ought to be paying attention to. So poverty, I believe the message here should be treated as a disease. So that means we have to develop strategies that enable us to do that. And I'm going to talk about a couple examples where poverty has been the overwhelming factor that contributed to a disease in children. I believe as a pediatrician that all illnesses start in children if we can just detect them early enough. When you think of heart disease, you think of a middle-aged or an older person, maybe somebody my age. But the reality is when you look at young people who have died in tragedies and look at their blood vessels, you see atheromatous plaques. They start in early childhood. We don't pay attention to that, and that also relates to all of the factors that I've just said. So I wanted to tell you something about a sugar story. So many of you know about bills that have been tried to pass to eliminate the sugar. I want to give you a picture of what the sugar problem is in the United States. 50 years ago, we consumed 20 pounds of sugar per year, a person did. Now it's 130 pounds of sugar a year. And as shown in this next slide, an average 5-year-old consumes 64 pounds of added sugar per year. That's 60% more sugar than the child's birth weight. And we let that happen? And when we try to change or create laws that do this, the companies that benefit from putting sugar in drinks are so powerful that they eliminate a change. That's not acceptable. People that come to TED know that's not acceptable. You're the ones that are going to have to lobby, actively engaged, and do something to change this. So poverty equals diabetes. When we look at diabetes in children, there's a 20% increase. In African Americans and Latinos, there's a 1 in 4 chance of developing diabetes. Now, 30% of the diabetes that we see, and we have 1,000 children that come for care at Oakland Children's, 30% of them have type 2 diabetes due to obesity. This is not acceptable. Now, another thing that I think is really important for you to appreciate is what happens during the first 3 years of life. It's like the stage is set, like this stage, to really pattern you for the rest of your life. And what's known now is that 2 million synapses per second are laid down. So you can imagine this 18-minute talk, if you were below 3 years of life, what would happen in your brain development? Well, if you're in an environment where you're not getting mothering, where fathering, where you're not getting food, where there's an enormous amount of stress that I would consider toxic stress, because we all have stress. I mean, giving this talk created some stress, but hopefully I can manage it, and I'm managing it the right way. And I'm too old for some of these things to matter right now, but if I were under 3 years of age, it could be a major factor. And so we had a very young, excellent speaker. Maybe next time we'll have somebody that's under 5 years of age. But at any rate, how this occurs is that we affect the brain development. And now there's data that even the DNA can be modified as a consequence of stress. And it's called methylation, and the DNA gets methylated in an epigenetic phenomena. And when this occurs, it's permanent. So if you look at a group of children that were in high stress environments at birth, in poverty, as opposed to another group that weren't, and then you study them when they're teenagers, you see dramatic differences in this methylation that causes an effect on their development, on their growth, on everything related to their education and future. Now, I think it's important, though, to keep in mind that there are several things that the United States could step up to, and I want to talk a little bit about them. The first is I wanted to let some of you know, and there are people in this audience from Children's that I'm sure know about this, but that there's a Children's Bill of Rights that really is accepted globally, except for 3 countries. And you can imagine United States is one of these. And what the Bill of Rights does is it guarantees education, it guarantees food, it guarantees a safe home, it guarantees prevention of violence, and it guarantees care for children, whatever the care might be needed. Affordable care will offer access to care, but it's not going to address these factors. Additional ways have to be done, and we should carefully look at that again. Now, the bottom of this slide shows something that I think is really important, and that's child labor. So whenever people began to notice that child labor was a problem, they said, well, we should do something about it. And there was a battle that went on that's not dissimilar to the battle we'd have to face if poverty were equivalent to child labor. And that battle is that there are political pressures that don't want poverty to be addressed. There are family pressures that don't want the government to intervene. And there are social pressures that really limit facing poverty as a problem. But if we don't face poverty as a problem, the 40% of children that grow up in that setting will be destined, for the most part, to lives that are very stressful and that are not as productive. And what is really tragic to me, and I've seen this many times, is that there are people with such great potential who were never given the opportunity because of the cards they were dealt at birth. They didn't choose those cards, but that's what they have. And I think we have a responsibility as citizens and people who care about the health and well-being of children, and I suspect people that come to a TED Talk could be put in that category, to do something about it. And I really encourage you to consider that. Now, we spend a lot of money on health care. You hear this all the time. You've heard this with Affordable Care Act and how this is going to give better care for lower cost. Did you know that the United States spends almost as much on health care as the rest of the world combined? Yet when we look at healthy outcomes, we're about 50th of all the countries, and there are many underdeveloped countries ahead of us. That's not right. That shouldn't be that way. We have to do something that changes that, and the main thing that would change that would be addressing the consequences of poverty. So I want to give some recommendations about what you could do and what I think really needs to be done if we're going to address this. First of all, there needs to be some way to find out what are the mechanisms that can bring tax dollars or other dollars into families so that there's a guaranteed support to live out of poverty. How can we support early education? How can we support access to food? How can we address the fact that many children that are obese, 30% of the kids at Children's Hospital have a BMI in the obese range, they're going to be likely to get cardiovascular disease, renal disease, hypertension, other complications. How can we create a safe environment so that they can go out of their house and play and exercise and not be behind the TV all day because it's not even safe to go out? How do we create daycare so that young people who have young children but are poor can afford a quality daycare? We're one of the few countries in the United States that doesn't offer daycare. If you take a look at other developed countries, almost all of them have daycare services that are high quality, that are managed appropriately, and that kids benefit from. And if they don't get that in the first year of 3 years of life of the nurturing and the support for their development, they're going to have problems later in life. So I think what I'd like to leave the message here for my passion is that we all have a responsibility. I may have a different one being a CEO in the hospital and a pediatrician with a lot of experience, but we all have a responsibility to carry this message and to do something in our communities and nationally, and to think about how poverty is a disease that has to be addressed. I want to thank the people who invited me to give this talk. I want to thank the audience for listening, and I appreciate your support in trying to make a change in this very passionate area of medicine. Thank you very much.